Well, you've heard the expression, there's a pill for everything, right? And those pills tend to have long-lasting side effects. Well, now there is a new study that shows that certain drugs, like ones used as sleep aids or for allergies and chronic diseases, are linked with congenitive impairment and increased risk of dementia. Bay News 9's Dr. Randy Schutt goes in depth about those findings with a doctor from the Florida E.N.T. and Allergy Center.
Joining me now is Dr. Scott Powell. He is a E.N.T. surgeon and works at Florida E.N.T. and Allergy. Today we're going to talk about a study that just came out that puts some over-the-counter medicines in a different light for us. So let's talk about the study. The study is about dementia and over-the-counter medicines that have anticholinergics. So going backwards, what's an anticholinergic?
Well, it's used for a variety of things. Medications tend to have side effects, but in my area of expertise, a lot of the antihistamines from Benadryl all the way up the ladder to the newer Zyrtex, they're designed to reduce the histamine response amongst that pathway. And so, you know, for this study, they did a radiology study and showing brain atrophy in relates to dementia risk, and it was quite alarming.
Yeah, so the study was actually done in Indiana?
Correct.
And they were actually looking at these drugs to see if it had an effect on our memory, dementia process. And as you said, radiology was doing it, used a thing called a PET scan. So the PET scan looks at CO2 and sugar that goes up into the brain, they tag it. And in this, the PET scan showed diminished areas of uptake, or what was the outcome?
Yeah, so decreased metabolism for the sugar, and also on the MRI side of that, they actually showed shrinkage of the actual brain cortical function.
All right, so obviously this means a lot to us because we have a lot of people, as we get older, dementia is a normal process, but this might be hurrying us along a little bit that maybe we don't have to have.
That's correct. And they showed medications as little as 6 years showing the effects, and anything past 60 days they started to show effects. And so it piggybacked off of a study they had done a few years ago showing the risk.
So some of the medicines they mentioned, you were talking about your antihistamine, so Benadryl and the old Dimetapp is on here as well. Dramamine for seasickness or dizziness. But some of the other ones I didn't think about. There's one for bladder control, urine control, Vesicare, and then Paxil, an antidepressant as well. So all pathways kind of are similar. We were talking about the atypical antipsychotics using the histamine component as well. So a lot of these medicines are just kind of hidden. It's not their goal, but if it dries us up, it causes that brain to do the same thing.
That's right.
So when we look at these, when we look in these treatments, we always are worried about medicines. Docs talk about medicines we write prescriptions for, but these are over the counters. So what are your recommendations on that?
Well, that's exactly it. The problems now is more and more medications are going over the counter, which is nice for the patient benefit, but we don't have any control when they stop it unless we see them back and educate them. And so the concern is as it becomes month after month, year after year, which I have many patients who do that, the risk is down the road they won't see the effects, the dementia risks, the memory risks, and that's what we have to educate with.
Sure. Now, someone with me, I was born in Florida, raised here, year-round allergies. If I don't take my antihistamines, I sound a lot differently and I have a lot of problems. What would you recommend for someone like me?
Well, there's a few things at our disposal. A lot of the topical medications, which are even over the counter, like a Flonase or Nasonex, topical steroids, are much safer than this medication, less systemic effects. And also, once we figure out what someone's allergic to, we can offer desensitizing them with allergy shots or allergy drops, which have been around for a long time, and just have a safer, more fine-tuned treatment course.
Sure. Now, when we talk about these, we're talking about doctor visits and follow-ups and everything else, and a lot of people have challenges with that.
Sure.
These over-the-counter medicines, we're trying to find that they're having some risk because of no supervision. Where do you see that balance? How do you think we should manage that a little better?
Well, a lot of times the allergy profile, once we know when someone's allergic, we can tell them, okay, for this month or two, you'll need these medicines, choice A, B, or C in that order. And then based off of that, you should be able to come off of that. And that's the key. It's kind of a roadmap to their year of allergies. And if they need it month after month and it doesn't go away, well, then we need to elevate. We don't want to have the risk just so they're feeling symptomatic free for now.
Sure. Now, over-the-counter doesn't mean safe. I mean, that's the interesting part is most of these medicines, actually all of these medicines, were prescriptions before they went over the counter.
Correct.
Most common reason why things go over the counter, people think they're safe, but it's really because of other reasons.
Yeah, a lot of the reasons is they run out of their research protocol with the companies who paid to have the research, and they run out of that process, and they get released to over the counter. And then a whole other company takes over and starts selling it, and that's that aspect of things. So the control function of the FDA does kind of lapse, and you're right, it becomes an issue of more control.
Yeah. Now, pharmacists obviously would be a good person to have this conversation with as well. So if you're having to go there and you're looking at these specific things, what are some of the better questions to ask the pharmacist about side effects or long-term effects?
Just how much, with the anticholinergic effect, how strong are they? Benadryl is significantly stronger with a grading scale than like a Claritin or a Zyrtec. A lot of these medications like Tylenol PM, they can decipher what all these words mean. There's so many words in there that they can tell you, yes, this is what it is, take it for this period of time.
Right. And there actually was a study about Benadryl and driving, and that was actually a very dangerous study as well because it had a lot of drowsiness and sedation. Of the things that we have, the antihistamines are a portion of it, the anticholinergic portion of it, the decongestant portions of it. Does it make a difference for the patients long term?
It does. I mean, temporarily they'll change their pathway and their symptom pathway, but the problem is they get lumped together in a lot of these medications. They'll take one here or there, but now a lot of these medications are all put into package deals, and so they're getting it from both sides.
Wow. Yeah, my wife and I have a chronic conversation about what an antihistamine is. She thinks Adderall cold and sinus is an antihistamine. I try to tell her that's a decongestant. So probably that would be a better choice when we're having the runny nose if we have to use it a little bit longer, but there's side effects with that too.
And they'll usually slide in some antihistamine in that as well. So it's
a tough thing. So obviously the idea behind over-the-counter medicine is a little bit more challenging. Your area is really challenging because in Florida we have allergies year-round. There's no hiding from it.
Right.
HEPA filters, stay inside, anything specific that would help me?
Yeah, the preventive side is HEPA filters, cleaning the carpets, avoiding carpets, avoiding down pillows, shower time, make sure the vent's on to get some airflow and so forth. But most air conditionings will get that to happen. Outside, you're kind of stuck. It's a lot of avoidance, and it's tough to do because nothing dies in Florida. There's no freeze, there's no frost, and so it just builds and builds. And so the best thing to do is to kind of know when you need it, dive in, treat it, but dive back out.
Yeah, and that's something I think we all have to take care of because I don't really think about it. It's my routine medicine. I take it every morning.
Yep.
Maybe that's why I'm not as smart as I used to be. Well, thanks so much for joining us today. Thank you for showing us about the study. I'm sure you said you had a lot of questions about this already. Over-the-counter medicine, safety issues, profiles, who to talk to, and what else we can do to help our chronic conditions be managed a little better. So thanks so much for joining us today.
Thanks for having me.
Now, if you'd like more information on the list of drugs the doctors were talking about, be sure to head on over to our website at baynews9.com.